What's up, guys? Today I'm going to show you guys how to hold your baby to reduce that upper back and lower back pain. So we got our lovely baby here, Ember, and she is 4 months old, and my wife's been complaining of some upper back pain since having her, and it's very common. You know, you're in this position breastfeeding, holding, all these things that you're kind of rounding these back shoulders, or the back and getting rounded shoulders here, and trying to activate these upper back is what you should be doing. So first thing we taught her is not to put her on the hip and hang out there with all that pressure on the hip. So I know we all do it. We put her here, use it as a shelf and kind of shift our hips over like that. That's kind of putting a lot of stress on that back on that one side and on that hip on that one side, and not engaging a lot of those stability muscles in your core and your bottom muscles. So instead, you're gonna put her on that hip. Go ahead and put her on your hip here. Make sure that if possible that you're holding with your bicep here and kind of keeping stacked where you're on both sides here, instead of shifting over here like that. So we don't want to be shifted like that too long. If, for God forbid, you do it, make sure you're on equal sides so you're not always on one side every single time. So if you're always on that one side, it's going to throw some things off, make you tighter on that one side. So if you're going to do it, don't. But if you are, make sure you're even on both sides. Doing it on this side half the time, this side half the time. Second, for those upper back and shoulders, so if you're breastfeeding, especially, you're in that position with those rounded shoulders, looking down, holding the baby like that. As much as you can, there's sometimes you can't get out around it, but as much as you can, while you're in this position, think about pulling those shoulders a little bit up and back to try to engage those muscles so they're not just in this rounded position this whole time. So remember, it's all right. We're just doing a video. So get in that position, squeezing those shoulder blades back. It's gonna work your bicep more, but it's also gonna activate a lot of these shoulder muscles so that you're not just rounded, putting all that pain and stress on your upper back the whole time. Thirdly is for the neck. So I know we're always looking down here at the baby like this, but as much as you can remember, try to just do a little chin retraction with the shoulder blades retraction, just to kind of loosen up that neck so you don't end up with those shoulder blades rounded and that chin out like this, making that little hump that we all dread getting as we get older. So shoulder blades back, chin tuck is gonna help reduce that pain in the lower neck. So doing these should help you reduce the pain in your upper back and your lower back and hips while you're holding your baby all the time. But if you got any other problems with your upper back, lower back, hit us up, talk to a physical therapist. A lot of times after pregnancy, there's a lot of problems down here in your hips and your lower back. So seeing a physical therapist to kind of work those out and figure those out is gonna really help.